Welcome to today's video to support anyone who has an occupational health nurse interview coming up. This video includes lots of tips to help signpost key areas to research and some example questions to prepare for. So I hope it helps you and I wish you every success in your interview. So key areas for your background research include checking on the type of interview that you're having. Is it a straightforward face-to-face interview with a panel of interviewers? Is it a value-based interview where you've got less questions, but your answers in a value-based interview need to align with the values of the employer or professional values? And I'll talk about value-based interviews later in this video. The invitation that you receive should state what type of interview you're having, and some employers, for example, might have scenarios, so you're asked to write a report as part of the interview, so it's helpful to look at report writing in occupational health. The next thing to do is systematically go through the job description. So you know the key responsibilities of the role. It might link to health surveillance, it might be pre-placement assessments, it might link to vaccination programs or any specific staff wellbeing initiatives, for example, that you are responsible for delivering. So you might have questions on those areas. Will you be clinically supervising or educating others as part of your role? Which staff groups, is it employees or is it staff members? So if you're going for a team leader role, you might have people in your team that you're supervising. If it's a leadership position in occupational health, your role might link to regular auditing or service evaluations. Are you responsible for leading teams across nurse-led clinics, for example? So, as I said, these details should be in the job description, but also it's helpful to book an informal visit to gain more insights. I'd always suggest booking an informal visit. Here you can talk to people in the role, you can see the service, the occupational health service being run, and you usually request an informal visit in the UK by emailing the recruitment lead or the manager or HR, whoever the contact is on that job application. And during an informal visit, you're usually shown around the service and you have an opportunity to ask questions about the role. So you can look at the job description before your informal visit and see how the service runs. Are there any challenges? And all of this gives you more insights into the role, and it might help inform an answer to a question at interview. If you can't secure an informal visit, you can try and book a telephone call or a virtual call. A good tip is to try and book an informal visit or phone call as early as possible. So preferably as soon as the job is advertised, because managers are very busy. So when you see that job advertised, phone them up and say, could I come for an informal visit, or could I have a chat on the phone about the role? We also have the employer website, and the employer will have their values on there or their mission statement. And you might be asked a question, why have you chosen this specific employer? What values do you align to linked to the employer? Also, it's helpful when you look at employer websites, look at what their future service plans are. That, for example, you might see a plan to reconfigure occupational health or amalgamate occupational health service, or there might be an introduction of a new electronic record system. And it really shows that, it might come up at interview, it might be that you bring that into a question, for example, or they might say, if they ask you why have you applied for this role with this particular employer, you could bring some of these aspects up and they know then that you've looked at the website. If you've applied for a senior occupational health role, a clinical manager in occupational health or a senior occupational health advisor, for example, then you might also have to do a presentation as part of the interview. The more senior the post, the more competitive the interview will usually be. And it's important to prepare for the presentation, as it can be the difference between getting the role or not. So don't neglect the presentation part of any interview. I've got a free video on my YouTube channel that offers lots of key tips to help you prepare for a nursing interview presentation. So do check it out if you're asked to do one. Another part of your background research for interview is revising key healthcare terms and definitions and local and national standards, regulations, policies and frameworks that might come up at interview. So if you're applying for a role that requires audits, for example, then you need to know what an audit is, what an audit cycle is, how do we learn from audits. And it's very easy to go blank if you're asked, how does your role fit with the audit cycle? What is evidence-based practice? What is your leadership style, for example? So it's very helpful to have a read around key terms and definitions. You'll see some of them maybe in your job description, but any that link to the role that you've applied for. When reviewing key regulations and standards linked to the role, it may include health and safety regulations. So, for example, if part of your role is to conduct DSE assessments, display screen assessments and workstation equipment assessments, you should review the current national regulations for assessments, and there you find all of these resources on the Health and Safety Executive website. If a big part of your role is assisting employees to return to work or to conduct fitness to practice recommendations in the UK, what are the current standards, the policies and recommendations in this area? So having a look at updating yourself with some of those key areas is very helpful. If the role entails advising staff on needle stick injuries, read the current health and safety SHARPS instrument in healthcare regulations. If it involves work assessment standards, review the NHS employer website for work health assessments. It depends on your specific role and your responsibilities. Another area to think about is current topics or any areas of interest in nursing and occupational health. For example, supporting staff with long COVID was very topical. So reading current occupational health journals and articles is also helpful. In line with knowing about up-to-date regulations and policies, it's helpful to look at some UK resources and websites, but just to be aware that they might be added to, they might change. This is January 2025 and the names of organisations change, but the principle is the same. There'll always be some key websites and some key national resources to look at. So currently some helpful resources are the Health and Safety Executive website. This has got a wealth of important information. Occupational health roles are usually multifaceted and you can't be expected to know every regulation, every standard and every guideline, but it's about knowing where to get key information and signposting. So the website has key resources ranging from how to make a RIDA report where you report injuries, diseases or dangerous occurrences, to COSH risk assessments. That's the control of substances hazardous to health. So for example, safe handling of cytotoxic drugs in the workplace. Also, there's lots of resources and advice linked to health surveillance, pre-placement questionnaires, absence management and return to work on the Health and Safety Executive website. Another good website is the NHS employer website, which has lots of resources. You've also got Government Department of Health websites, gov.uk and NHS England. I'm in England, but the four nations, we've got NHS Wales, NHS Scotland and Health and Social Care Northern Ireland. A big part of occupational health nurse role is communicating with local and multi-agencies, national multi-agencies, and signposting support for employees. So reviewing what's available for employees' health and well-being. Review the current employee assistance programme. That's a free and confidential service that offers support and guidance to employees. We also have staff mental health and well-being hubs and support. Also maybe look at some NICE guidelines, standards, recommendations and local employer websites as well. I have some helpful free videos on my YouTube channel on some key areas in healthcare that help people revise for interviews, for any interviews really, but they were really helpful for revising key terms such as quality improvement and quality assurance. What's the difference between these terms? And one on risk management, clinical governance, clinical audit, the PDSA cycle, service evaluations, nurse education and leadership, and it very much depends on the type of role that you're going for, but these aspects, these terms and definitions may come up, so they're helpful to revise for interviews. I mentioned the term value-based interviews earlier. So what is a value-based interview? Value-based interviews, or VBIs, aim to select interviewees who align most closely to the values required in the role. They may link to employer values or professional values, and you're usually asked one key question that aligns to this core value. So a value might be compassionate care, and a question could be, talk me through an example where you've provided compassionate care in a previous role. Once you describe what happened and give this example or this scenario, the interviewer then asks more specific questions about the example that you've given, and they drill down on some of those details that you have to recall at interview. So a couple of tips for value-based interviews. The example that you are going to share at the interview should relate to you and the impact you made. So some of the details might involve other people, but the interviewer wants to know that you align to this value. So a classic mistake that people make is they start talking about observing other people, or they talk generically about, I always provide compassionate care to my patients, whereas they want a specific example linked to a patient. And it should show that you made an impact or difference in that situation. They want to know that you respected others, that you acknowledged other people's perspectives, that you were able to problem solve. It depends on the value that they're looking at. So in a value-based interview, don't just talk generically about the topic area. Also, don't make up the example. It needs to be a real example, because when you're asked more details by the interviewer, if you've made it up, it's going to be difficult to recall what actually happened if it's not a real example. So prior to your interview, whether it's a value-based interview or not, it's helpful to think about some key case examples from your current role or a previous role, in case you're asked to talk through an example, and or you might want to give an example as part of building up an answer to a question. So think about where you've integrated evidence-based practice and quality standards, or how you utilise current research in your role. A question could be posed such as, how do you keep your practice up to date? So think about how your practice is evidence-based, for example, and informed by current standards and regulations. Or you might have a question linked to quality improvement or service evaluation or risk management or decreasing risks to staff or patients. Could you give me an example of how you maintain quality in your role, or where you improved the quality of care for patients, or where you decreased patient safety risks across the service if it's a leadership role? So it's important to think about some good examples where you demonstrate those core transferable skills in these areas. And that's why the previous slide where I mentioned about the videos I've got that will give you an overview of some of these key terms is helpful, because you need to understand, well, what is quality improvement? What's the PDSA cycle, for example? So what's clinical governance? What these terms mean, to be able to get those examples. And one example that you have from practice may demonstrate several core skills in several of these areas. Other good examples to look at are effective team working, where you've demonstrated collaborative practice. Also leadership or organising and managing your caseload. Education and health promotion example, or dealing with a challenging situation that you overcame and learnt from. So starting with some example generic questions now that you might be asked. So nearly all interviewers are going to ask an initial question about why you've applied for the role. What attracted you to the role, what led you to apply to this service or to this employer. So all the previous tips I gave you relating to background preparation will help you answer that question. They might ask you to tell me about what you know about us as an employer, or as an NHS trust, or a community setting or service. So you should have already reviewed the employer website, know about their values, the mission statement, what goes on in this service. They might ask you about what key skills are required in the role, or what values do you have for the role, or why should we offer you this opportunity above other candidates? So to answer these questions, you should know the key responsibilities from reviewing the job description. You should have clarified anything you're unsure of relating to the role before the interview, either through an informal visit or a phone call, reviewing the job description. When you're drawing out the key skills required in the role, and your current transferable skills and how they relate, a big part of the occupational health nursing role is communicating effectively between staff, employees and managers, and the complexities that can entail, especially if a manager and an employee doesn't agree, for example. And so these are skills you need to think about. What are my current skills, communication skills, and how can they be applied in this role? Managing your time effectively to meet key deadlines in the occupational health service. Organising your caseloads. How do you organise caseloads in your current role, for example? Leading service evaluations and audits. You're using clinical assessment skills and signposting staff to multi-agencies, for example, to different agencies, and referring them on because a staff member might be struggling, for example. Also educating others and health promotion. So how do you educate others in your current role, for example, and promote health in your current role? And professionalism is paramount in an occupational health nurse role, maintaining confidentiality, adhering to data protection legislation, storing occupational health records. You've got health and safety legislation, occupational health legislation requirements too. So record keeping is a big part of this role. So you're going to have do that in your current role, and there will be these transferable skills that you can answer that would help you answer this sort of question. So some more generic questions you might be asked. What are your strengths? So think about how you would answer this question. Another classic question, it's going to be different for everybody. Another classic question is, if you're offered the role, what challenges do you envisage when you first start in the role? Tell me about a time when you overcame a challenge or learnt from a challenge. How do you manage your work-life balance? What strategies do you use to manage stress at work? So you might have large caseloads and key deadlines to meet as an occupational health nurse, and the interviewer needs to know that you can manage your caseloads, you can determine when you're feeling stressed, or you've got strategies to deal with stress, that you aim to maintain that work-life balance. And how do you do this? How do you relax out of work? It could be swimming, it could be reading. They need to know that you'll escalate to your manager if you're unsure, that you'll seek additional support if you're struggling. So you should know the team structure in occupational health, and who can you go for support. Often on job descriptions they will define the structure, or you can ask about the structure and about the line manager that you could go to, for example, the different types of roles, because we all have days when we need that extra support. So usually they want to know that you would ask for help. Another classic question is, where do you see yourself in 5 years' time? And that again is going to be individual to you. If you're preparing for a leadership role in occupational health, I have a video free on my YouTube channel, preparing for a band 6 or 7 senior nurse interview. I've got a whole playlist on developing leadership skills, coordinating care, teamwork in nursing, and a video on how to deal with conflict and incivility. So they're all free on my YouTube channel, and you might find those helpful for more senior level questions as well. An important aspect of the role of an occupational health nurse is education and health promotion. So starting with your education, you might be asked, how do you keep yourself up to date with research, the latest evidence? Think about the occupational health nurse's role that links to national health and safety regulation, NMC professional standards. Where do you find the data, which I discussed earlier in the background research you should do before interview? Another question might be, give an example where you educated or supported a patient or a staff member or staff members who were struggling. How did this teaching support impact on them? How would you plan to teach a group of managers about new occupational health standards across this trust? They want to see that you're using a systematic approach if you're planning one-to-one teaching or a group program, that you're able to problem solve, complete a target and goal effectively, that you'll set aims and objectives and ensure that a program or education session is delivered on time. And you might need to use a flexible approach considering managers are busy. Think about the strategies you're going to use to deliver a program. Will you do teaching online, face-to-face, e-learning? What other resources and communication strategies could you use? And again, it depends on how the questions posed. They might give you a scenario that you've got to deliver some type of teaching, but think about those educational aspects of the role. Another question might be, what would be your first 3 objectives if you were offered the role? So think about those SMART goals being measurable and achievable. You also need to know what an objective is to be able to answer that question. So you might want to revise that. For a more senior role, you might be asked how you would ensure the learning needs of your team are met. How would you promote compliance with statutory mandatory training or with appraisals? So these are a few sort of education type questions there you might want to consider before interview. Then we've got some scenario-based questions that often come up at interview. What would you do if X, Y, Z happened? I've got a few example questions here. You know, they might not come up, they might be similar, they might not. I mean, it's very specific to the role and job description, but it gives you a bit of a feel of some sort of types of questions that might come up. So often you're asked a communication type question. It might be how you would communicate in this situation, or they might give you a communication issue or a breakdown in communication. But an example question might be, a staff member informs you that another team member is always rude to them. They feel they're being bullied whenever they work in the same clinic. What would you do? So think about what strategies you could use to support them. You need to actively listen in a quiet place away from others, treat them kindly, compassionately, try to support them to report this to their manager. They could seek confidential advice from a freedom to speak up guardian or human resources consultant. There's lots of different aspects you could look at there. I'm not going to answer the question for you, but similarly, if you're going for a leadership position, you might have to resolve incivility or conflict between 2 staff members in your team. So how would you plan to resolve conflict between these staff members who are refusing to work with each other? So have a read around de-escalation, resolving conflict in the workplace. I've got a free video on my YouTube channel with lots of tips linking to promoting effective team working and also how to deal with conflict and incivility in the workplace. So that might also give you some tips and strategies. Another issue linking to communication might be a staff member or a manager who's not engaging with occupational health procedures. And that's a classic question really. So for example, an employee not engaging with fitness to practice or phased return, or they refuse to attend health surveillance assessments, or how would you deal with this? Or you could have a manager who's not adhering to process, or who's not happy with a letter or a report that you've sent regarding an employee's fitness to practice. So think about effective communication strategies with these sort of engagement and communication issues, and you're trying to develop that trusting relationship with the staff member or manager. Is having listening skills, open communication, educating them through the process and supporting them, whilst you're balancing the communication with the need to meet deadlines, and you have to adhere to legislation and process. Some other topic areas that might come up linked to recording, reporting, occupational health data and storing data, and the professionalism around that and confidentiality around managing personal health data. So an example question I've got here is, what would you do if you discovered an employee's health file has been left open on a computer screen in front of another employee, so there's been a data breach? Or you might find health records left on a desk in an open area. Or you could just be asked a question about current general data protection regulation. So it's helpful to review what is the current regulation and to also look at your professional NMC standards. You could be asked how to plan or disseminate a new occupational health legislation or changes to local policies and procedures. How would you go about that? Another question might link to a regular procedure that you do. So it might be a procedure regarding occupational health. So classic ones linked to needle stick injury. So this question is, how would you advise and support an employee who is distressed following a needle stick injury? This question is not just about adhering to current procedures. So the NHS currently recommends wash the wound with soap and water, you squeeze the wound to encourage bleeding, etc. I'm not going to give you the full answer because you could look that up, but also this question states that the person is distressed. So there's an element of reassurance, putting their mind at rest. It depends on what the question is. So do listen to what they're actually asking. Another classic scenario is supporting an employee who has contact dermatitis. So they might require hypoallergenic gloves. So again, it's that adhering to process, supporting them, advising them, and being empathetic. Signposting services is another key aspect of an occupational health nurse's role. So an example question here might be, what would you do if an employee's mental health had severely deteriorated from when you spoke to them a month ago? A part of your role might be doing health assessment questionnaires, pre-placement questionnaires, but knowing what services are available to refer and escalate issues if you're worried about an employee. The need for documenting, recording the situation. I'm not going to answer the question for you, but looking at sort of questions relating to these types of questions is helpful. So what free services are available to support employees' well-being and physical and mental health? We've got national and local staff mental health and well-being hubs in the UK, for example. So you can signpost staff to a range of free services and support networks. So checking those out prior to the interview is helpful. There's a list of them on the NHS England website, for example, and NHS trusts have them listed on their intranet sites usually. So if your role involves setting up a vaccination clinic or running and leading a team across the service, if it's a leadership role, you could be asked about how you would plan a vaccination programme to deliver a set number of vaccinations to a set number of staff over a set period. So think about how you would answer, how you would plan and you would implement such a programme. Think about the barriers and facilitators to that too. How would you plan to set up a workplace healthcare promotion programme? So for example, work's becoming more sedentary with increasing emails and auditing and we do a lot more desk work. So how would you promote better posture when sat at desks educating administration staff, for example? How would you go about setting up this workplace healthcare promotion program? So they might give you a specific example, an example program, for example. So think about how you would go about doing that. So I hope that some of those questions have helped. But if you're not offered, hopefully you'll be successful. But if you're not offered the role, it's important to learn from your feedback. Always request verbal feedback. If they forget and the feedback's not forthcoming, put another request in again in writing in an email and CC the HR recruitment lead. When the interviewer does feedback, have some questions ready to ask. For example, which were my weaker answers, which were my stronger answers, how could I have improved my answers, which areas do I need to work on? Word it however you want, but make sure that you ask those questions because it will really help you to reflect on them and it will help inform your future interviews. Reflect on that interview feedback because if you apply for the role again, it will help you. And also, if you can remember the questions that you were asked, write them down. They might be slightly different, but they might be quite similar next time. And then finally, if you find that your interview techniques, you keep going for interviews, you're not getting them, try and book someone to do a mock interview or attend interview workshops. There's lots of staff development days now that are starting to offer interview tips. You might want to buy my book as well. I have a book, How to Prepare for Interviews and Develop Your Career as a Nurse and Midwife, and that's got lots of tips in too. So good luck with your interviews. Do let me know how you get on in the interview in the YouTube comments. or if you prefer to ask any questions at all, you can DM me privately on Twitter. And as I said earlier, do check out my books as well. You might find those helpful for future interviews.